House observed in 1919, the federal government lacks the police power. By design, the framers of the Constitution established the U.S. government as a system of specifically defined powers. Some of those powers have come to be understood as giving federal officials and the Congress certain authority over questions of public health. The enumerated powers over interstate and foreign commerce are leading examples. Many jurists contend that broad enumerated powers like these offer the federal government a sweeping authority that would include virtually all questions of public health. For much of the 20th century, the Supreme Court seemed to agree. But the framers did not specifically enumerate a federal police power, at least not as such, and the 10th Amendment to the Constitution, ratified in 1791, seems to affirm the basic point: the powers not delegated to the United States by the Constitution, it reads, nor prohibited by it to the states, are reserved to the states respectively, or to the people. The basic police power to look after the health of the people is one of the powers so reserved. In the absence of a federal police power, and without federal political will to act through the commerce or spending powers, legal measures in the United States to stop the spread of contagion have mostly been the product of state law. State and local governments have typically been the source for quarantines, vaccination mandates, condemnations of contagious property, and basic safety measures of countless varieties. States, however, do not act unconstrained. For one thing, the general state police power is itself hedged in by enumerated federal powers. In the first half of the 19th century, courts worked out boundaries between state police powers on the one hand and federal power over interstate and international commerce on the other. Moreover, the civil liberties of individuals limit what state governments can do. The federal Constitution, especially the Bill of Rights and the 14th Amendment, guarantees rights such as freedom from unreasonable arrest, as well as freedom of speech, religious liberty, and private property, all of which have been pitted against public health and the police power at times in American history. The ways in which infectious disease and the law have interacted with one another constitute a principal subject of this book. For decades, historians of science and medicine have debated a related but more general question: how does infectious disease interact with human societies? One view of the role of infectious disease in history contends that disease drives change. According to this school of thought, contagion forces the world to respond. Its imperatives forge new patterns and prompt new legal and political institutions. European settlers and conquerors brought diseases like smallpox and measles that killed as many as 90% of the 70 million or more people living in the Americas in 1492. Across the Americas, pandemic disease radically reordered authority and community. Medieval England, too, was remade when the bubonic plague killed half the population in the middle of the 14th century. Parliament established a new regime for conscripting labor, enforced by a new phalanx of royal officials. In such circumstances, epidemics make the state. A contrary school of thought argues that politics makes epidemics. Existing legal and social institutions shape the ways epidemics arise. Viruses evolve to take advantage of the world as it is, and the world shapes the ways germs spread. In turn, our institutions, ones we inherit from the past, powerfully constrain the pathways of our responses to epidemic. In the United States, for example, the decentralized police power channels epidemic policy into state governments and private actors rather than the federal government. Public institutions, in this view, give direction to epidemics, not vice versa. The truth lies in between. New germs help make new laws and institutions, yet old ways of doing things shape the course of epidemics and the ways in which we respond.